Artificial intelligence is revolutionizing medicine, but how can this potential be used in the best possible way? For example, if a patient is worried about their health, they can quickly obtain initial diagnoses with a symptom checker app. The app also helps patients decide whether they should see a specialist, and if so, which one. The app's algorithm provides the doctor with valuable information for taking the patient's medical history, even in the case of rare diseases, and it can support the choice of the right treatment. Artificial intelligence can be useful during an MRI examination, for example. MRI images consist of hundreds of thousands of individual image data in which neural networks recognize patterns and calculate the probabilities for certain diseases. To do this, they were previously trained with numerous MRI images and the associated diagnoses. The AI-supported assistance systems provide the doctor with important information for her own diagnosis. However, special skills are required to be able to deal with it in a reflective manner. In summary, these two aspects are particularly important. On the one hand, AI systems must be trained with as much data as possible in order to deliver reliable results. On the other hand, doctors need additional skills to be able to make better decisions in the interest of the patient, supported by AI. In this way, the potential of artificial intelligence for medicine can be used in a reflective and competent manner.